"Hi, Mrs. Smith. I know you're going to be discharged very soon, and Dr. Jones has started you on a medication called Coumadin. I'd like to talk to you today a little bit about Coumadin because you've been taking it here, but he also wants you to go home and continue taking that at home." Now, you came to us because you were having some difficulty breathing and chest pains. And of course, we found that you had an irregular heartbeat that we call AFib. Having AFib puts you at a higher risk for stroke because it can contribute to the formation of blood clots. So people who are at risk for blood clots are sometimes put on the medication that Dr. Jones has prescribed for you. That medication is called Coumadin. The way that Coumadin works, it affects the vitamin K levels in your body, and it helps to keep that blood thin and keep your body from producing those clots. There's some information that I want you to have. It's very important that you have this information about Coumadin before you go home. I'll go ahead and give you that information, and then any questions that you have, I'd love to answer those questions for you when we're all done. Okay, so like I said, Coumadin is a blood thinner, and it works by working against the vitamin K that's naturally produced in your body. So one of the things that you need to understand about Coumadin is that it has to be at a very particular level to work appropriately. This means that you're going to need blood tests every 4 to 6 weeks or so. Your physician will determine how often he would like for you to have these blood tests, but we do those to monitor the level of Coumadin in your body so that your blood is neither too thick nor too thin. If your blood is too thick, you're at a risk for blood clots. If your blood is too thin, you're at a risk for bleeding. Now, one of the things that you need to know about bleeding can be a side effect of Coumadin, and there's mild bleeding and there's major bleeding. It's important that you look out for signs of either mild or major, and if you notice any, you discuss them with your physician. So mild bleeding can be something as simple as increased bruising. You can find that you are bleeding when you're flossing, that your gums are bleeding when you're flossing. You may find that you have nosebleeds occasionally. They're mild, but it's so important that you speak with Dr. Jones about these side effects, okay, so that the physician can monitor them for you. Major bleeding, however, can happen, and it can come up as blood in your vomit if you're vomiting blood. It can come up as blood in your stool. It can present as a very, very strong headache, and it may even be that you feel weak, okay, if you're having any internal bleeding. So you may not actually even see the bleeding. You may just feel very different, very weak, very tired. If you start to feel an increase in anything like that, if you see any blood in your stool or your urine, it's definitely important that you talk to Dr. Jones and you go in for those visits, okay? Especially if you feel like it's a drastic amount of bleeding and you feel weak, I would call the office immediately to talk to them about that. Another thing that you want to know about Coumadin, okay, that we talked about how you'll have to go in every 4 to 6 weeks and have your blood checked. It's good if you take the medication around the same time every day just to help to keep in a routine of taking it and to keep that level steady in your blood, okay. We talked about vitamin K, and we talked about how vitamin K is a major factor in forming blood clots and how Coumadin works with vitamin K. So one thing that you need to know is vitamin K in your diet. So I've noticed that you like to eat a lot of green leafy vegetables. You eat a lot of broccoli. I've seen you eat spinach when you order meals, which is good, okay? But it's important that you continue to eat those that you continue to eat those foods just like you were before you were taking this medication. The key here is to keep a consistent level of vitamin K in your diet, meaning don't stop eating vitamin K foods and don't start eating an abundance of vitamin K foods. Just keep level. I want to show you this great little tool that I have here. This is a magnet, and this is going to go on your refrigerator, okay? This way you can kind of keep track of all the foods that you're eating. Okay, so you'll see this has got kale, collard greens, spinach, Brussels sprouts, cabbage, asparagus, okay, and it has their serving size and the amount of vitamin K, okay. This is a great way to keep yourself eating the foods that you love, but not eating too much or not enough of those things. Another thing that I really would like to strongly impress upon you about Coumadin, because of that risk for bleeding, it's important that you wear a medical ID, okay. Let's say you're in an accident. Unfortunately, that happens, and you are unable to communicate. You can't speak to the paramedics or the police officers or friends or family who are there with you. Being on Coumadin increases your risk for bleeding. If you wear a medical alert bracelet, anybody who responds to the scene of an accident or is there to take care of you will know to alert the authorities, the medical professionals, the physicians in the hospital, and let them know that you're on Coumadin so that we can manage you appropriately and monitor you for that increase in bleeding. Okay? Do you have any questions about Coumadin, Mrs. Smith?